The landscape for access to care for transgender young people is extremely challenging. It really puts those healthcare institutions in a very tough spot. And so we've seen a variety of reactions. There are some who have ceased providing care.
I've been providing gender-related health care for the past 30 years. This kind of treatment takes years. It's just not something that happens quickly or impulsively in any sense. These are very thoughtful, difficult decisions that are made by families and patients and their doctors.
Are there benefits, and who in particular benefits, and who may have problems with these type of treatments? I think that there's a major lack of knowledge about what are the long-term outcomes too, because this is, of course, the first cohort of young people in mass that have ever gone through these procedures. So we won't know for a really long time what the outcomes are.
Fact is we have decades of evidence-based information that suggests that gender-related healthcare is beneficial to patients and their families, with very, very, very scant incidences of regret or disappointment in that care. But we as scientists and clinicians and doctors, we also need to be critical of ourselves, and we need to track outcomes. We do need the evidence, but if the evidence is there, don't look past it. And that's the problem with the current administration. Evidence is there, but they don't want to see the evidence.
If you look at the substance and quality of the HHS report, it's excellent. And it includes a review of reviews, which looks at all the systematic reviews that are out there and analyzes the strengths and weaknesses of them. It has a excellent ethics section, and it's quite thorough. So I think that was a great step forward, the HHS review.
Well, HHS didn't do their own review. They just pirated reviews that were done overseas, principally the Cass report that was done commissioned by Hilary Cass in the UK. And as Dr. Cass even acknowledges, there is evidence that this care is efficacious. It's just not of a quality, which means that it doesn't include placebos, in other words, fake treatment, or randomized types of treatment that in this country we would consider unethical. It's a different level of scrutiny that is not afforded to other areas of medicine.
This is healthcare provided by licensed clinicians according to standards of care that have been around for many years. And to have the government interfering, to have politicians overreaching and telling parents, telling families that they can't get their kids the healthcare that they need, that is a very serious government overreach into the provision of healthcare.